My name is Jackie Klein, and my presentation will be on assessment and treatment of challenging behaviors. Challenging behaviors are defined as intense, frequent, and/or long-lasting behaviors that disrupt learning, threaten physical safety of self and others, and lead to restricted access to the community and services. Many individuals with disabilities, particularly those commonly associated with communication difficulties, engage in challenging behavior. 4 common categories of challenging behavior include physical and verbal aggression towards others and property destruction, disruptive behavior, repetitive and self-stimulatory behavior, and self-interest behavior. Physical aggression includes acts such as hitting, kicking, biting, punching, choking, scratching, pinching, throwing items, and headbutting. Verbal aggression includes verbal threats of any of these behaviors, profanity, or yelling at others. Disruptive behavior can involve a number of behaviors, including inappropriate vocalizations, temper tantrums, and attempts to distract peers from the task in which they are engaged. Self-stimulatory behaviors, also known as stimming, is seen in many individuals diagnosed with autism. It is a repetitive act that meets a sensory need. Some self-stimulatory behaviors include finger tapping, rocking, waving things in front of the eyes, repetitively watching the same video clip, bouncing on a trampoline, and swinging. Finally, self-interest behaviors are behaviors the individual inflicts upon his or herself that could result in physical injury. These include headbanging, self-cutting, self-choking, self-biting, self-scratching, hair pulling, skin picking, eye pressing, and pulling out one's hair. When addressing challenging behaviors, it is important to keep in mind the following ethical guideline 2.10, which describes the BCBA's obligation to provide an effective treatment. A. The behavior analyst always has a responsibility to recommend scientifically supported, most effective treatment procedures. Effective treatment procedures have been validated as having both long-term and short-term benefits to clients and society. B. Clients have a right to effective treatment. And C. Behavior analysts are responsible for review and appraisal of likely effects of all alternative treatments, including those provided by other disciplines and no intervention. That being said, my stance on this topic is individuals who engage in challenging behavior should receive an individualized combination of evidence-based treatments in order to systematically address target behaviors identified in the functional behavior assessment. Challenging behaviors pose several serious concerns for individuals with disabilities and their support group, risking negative outcomes for the general population, family, and school personnel. Aggression and other challenging behaviors are some of the strongest predictors of crisis intervention referrals, admission to residential facilities, and use of psychotropic medication. These behaviors are also lead to high levels of stress among parents of kids with developmental disabilities, out-of-home placements, and an increased risk of physical abuse from caregivers. Negative outcomes of challenging behaviors are also found in the classroom, identifying as a primary reason for teachers leaving their profession. Classmates who feel threatened by this behavior will not feel safe, therefore negatively affecting their mental health and learning. Due to the high frequency and debilitating effects of challenging behavior, it is imperative that they are first appropriately assessed by a functional behavior assessment. While trying to finish preparing dinner, a mother asks her 7-year-old son to help set the table. Her son runs past mom, hitting her on the back. Why? Is he trying to avoid the chore asked of him? Does he want mom to stop cooking dinner and play with him? Does he want to help mom prepare the food instead of setting the table? A functional behavior assessment is designed to help the researcher identify the purpose or function a behavior serves for an individual. Challenging behaviors, such as aggression in this example, are either being positively or negatively reinforced by the individual getting what they want or getting out of what they want to avoid. An FBA helps identify the reinforcement contingencies that are strengthening the challenging behavior. This information is necessary in order to create an intervention that alters this contingency in order to decrease the occurrence of the behavior and encourage more appropriate behaviors. The function of behavior includes social positive reinforcement or attention, tangible reinforcement, social negative reinforcement or escape, and automatic reinforcement or sensory stimulation. So let's take this same example and break it down into the 4 different functions. The 7-year-old boy hits mom, and as a result, she turns to him and says, "Sweetie, what's wrong? Do you want me to help you?" The boy stops hitting mom and engages with her. This is an example of a behavior reinforced by social positive reinforcement, or attention, and that attention is gained immediately from others by engaging in a problem behavior. Attention can take the form of eye contact, surprised facial reactions, yelling, babying, arguing, etc. The challenging behavior is maintained by these reactions from others and will continue to occur in similar situations in which attention is not or minimally provided. Now the 7-year-old boy hits mom, and as a result, she hands the boy a couple of his favorite kind of noodles. The boy stops hitting mom and eats the noodles. This is an example of a behavior reinforced by tangible reinforcement, and that the individual gained access to a wanted stimuli. Oftentimes, the stimuli is provided in order to decrease the unwanted behavior, in this case hitting. However, it is likely that this will make the problem behavior more likely to occur in the future when the individual wants access to the same stimuli. Now, a 7-year-old boy hits mom, and as a result, she tells the boy he does not have to set the table. The boy stops hitting mom and goes to watch TV. This is an example of a behavior reinforced by social negative reinforcement, or escape, in that the individual is able to terminate the aversive demand or activity. Other examples of escape include hiding under the table to avoid a bath, running away from a caregiver to avoid going to school, and screaming in the waiting room of a doctor's appointment to avoid a shot. All of these challenging behaviors are strengthened and maintained by allowing the individual to escape difficult or unpleasant tasks. And finally, the 7-year-old boy hits mom, and as a result, mom looks down to see a squashed mosquito next to a small bite on his arm. The boy stops hitting mom and proceeds to set the table. This is an example of a behavior reinforced by automatic reinforcement or sensory stimulation. Automatic reinforcement occurs independent of action from others, meaning that the behavior produces its own reinforcement. In this case, the act of smashing and killing the mosquito between his arm and his mother provided him with immediate relief from the bite on his arm. An FBA can typically be conducted in 4 steps. First, the behavior analyst gathers information regarding the individual and their challenging behaviors by indirect and descriptive assessment. Next, the behavior analyst interprets the information gathered from the assessment and formulates a hypothesis about the function of the challenging behavior. Then, the behavior analyst tests his or her hypothesis by conducting a functional analysis. Finally, the behavior analyst creates an intervention based on the function of the challenging behavior. For the purpose of this presentation, I'm going to split the discussed treatments into 2 categories: antecedent strategies and punishment procedures. Antecedent strategies involve manipulating the individual's environment before the behavior occurs in order to reduce the likelihood that the behavior will actually occur. Punishment procedures are interventions implemented immediately following the behavior that decreases the future likelihood of the challenging behavior. Providing the individual with choices and a written schedule are simple antecedent strategies that have been effective in reducing escape-maintain challenging behavior. Functional communication training is another effective antecedent intervention that teaches the individual appropriate communicative behaviors to replace the challenging behaviors they engage in to gain access to or avoid something. Alternative communicative responses in functional communication training include appropriate vocalizations, signs, communication devices, communication programs on an iPad or tablet, picture cards, or gestures. Although it has been a heavily debated topic, the use of medication to treat challenging behavior is another antecedent strategy when used carefully and only when completely necessary. Ideally, medication is only used when the challenging behaviors do not decrease as a response to applied behavior analysis alone. Unfortunately, psychotropic medications are often overly prescribed and have several side effects that could negatively affect treatment. Sensory integration therapy is another popular treatment among various individuals facing challenging behavior, despite the lack of evidence for its efficacy. SIT can often hinder progress because the sensory input is provided contingent upon the challenging behavior, therefore reinforcing that behavior at times. Sensory integration therapy is often incorporated by BCBAs with other treatments for challenging behavior, more specifically for repetitive behaviors maintained by automatic reinforcement. Sensory activities include jumping on a trampoline, auditory integration therapy, rocking, holding, brushing, sensory diets, and deep pressure strategies such as weight vests. Finally, parent training provided by a BCBA is an empirically based strategy that will not only ensure that the individual's treatment plan is followed while implementers are not present, but also increases parents' confidence in parenting their child with disabilities. Parent training includes explanations of strategies, including visual schedules, environmental manipulations, differential reinforcement, and techniques for delivering instruction in a way that promotes compliance. Punishment-based strategies are interventions implemented immediately following the behavior that decreases the future likelihood of the challenging behavior. These treatments are often controversial among individuals in the field of behavior modification because of their aversive nature. More emphasis has been placed on reinforcement procedures because they are more positive and less intrusive. Examples of punishment procedures include physical restraint, timeout procedures, and the application of aversive stimuli. Aversive stimuli can include more extreme interventions like spraying with water, aversive odors, and contingent electric shock. However, simply using the word no is an aversive to many individuals. Physical restraint is categorized as either manual or mechanical restraint. Manual restraint consists of physical pressure or contact by other people, whereas mechanical restraint involves the use of equipment like a vest or ties. Although physical restraint should be considered last resort and used only when necessary to keep the individual and others safe, 50 to 60% of children and adults with challenging behaviors experience manual restraint. There are several laws and regulations supporting an individual's right to an effective treatment for challenging behavior. IDEA, or the Individuals with Disabilities Education Act, is the nation's federal special education law that ensures public schools serve the educational needs of students with disabilities. IDEA requires that schools provide special education services to eligible students as outlined in a student's Individualized Education Program, or IEP. The IEP is a formal contract outlining the services and support the school will provide in order for the child to benefit from the educational program. Outside of the school, individuals with disabilities who engage in challenging behavior can receive financial support for services through various insurance companies, Medicaid, and the Department of Mental Health. In addition, autism insurance legislation is in the process of being enacted state by state, with various terms regarding implementation and coverage. Service providers are also held to a code of conduct to provide an empirically based treatment. As stated earlier in this presentation, this ethical guideline for BCBAs is Treatment Efficacy 2.10. As described in the previous slides, there are several various treatments that have been proven effective in addressing challenging behaviors. Focusing on one specific treatment, however, could reduce the effectiveness of the treatment as a whole compared to what a combination of various treatments could do for the client in all aspects of their needs. The first legal issue I will discuss is an example of a service provider who did not provide the most ethical nor effective treatment. In January of 2014, Brentwood Union School District in California agreed to pay $8 million to the families of 8 special needs pre-kindergarten students who were physically and verbally abused by their teacher. In this case, the Brentwood Union School District chose to ignore multiple reports of abuse against vulnerable children and allowed a teacher with violent history to continue teaching special needs children who could not speak. They reassigned this teacher to another school, again putting her in charge of special needs children who could not speak and gave no warning to their parents. Because of their disabilities, these children could not come home and tell their parents what was happening to them in the classroom. The suit claimed that the children's constitutional rights were violated by using unjustified and unreasonable force against them. The second legal issue demonstrates why effective interventions for decreasing challenging behaviors of individuals diagnosed with developmental disabilities is necessary for many aspects of society. Unfortunately, individuals diagnosed with autism spectrum disorder and other developmental disabilities are stereotyped by a large portion of society as being threatening and dangerous to others. In 2013, a West Virginia landlord was prosecuted by the U.S. Department of Housing and Urban Development, or HUD, for discriminating against a prospective tenant because of his autism diagnosis. The landlord imposed a series of conditions on this tenant, Dolores Walker, after she said her 48-year-old brother with severe autism would be living with her. The landlord demanded that Walker obtain a note from her brother's physician stating that her brother would not pose a liability threat. In addition, he requested they obtain a renter's insurance policy with $1 million in liability coverage and assume responsibility for any damage Walker's brother might cause to the property. The landlord told Walker he was making these requirements based on his prior observations of, quote, children with autism flailing their arms and hollering and screaming in outrage, end quote. Walker and her brother did not end up renting the apartment, but HUD took up the case, stating that the landlord violated the Fair Housing Act by discriminating on the basis of disability. Cases like this example can be easily avoided by ensuring the use of effective and evidence-based interventions when treating challenging behaviors. In order to promote an individualized combination of evidence-based treatments for individuals who engage in challenging behavior, moving forward, BCBA should be open-minded and using multiple intervention strategies to best fit the client and their needs, stay up to date on research of various treatments and their effectiveness, and provide ongoing evaluation of the treatment analyzed by data collection and direct observation.